What we want to understand is age in itself is not sufficient to explain this variability. We want to understand, we want to go into the CHSLDs and look at it from an immunological perspective, a cardiovascular perspective, and a psychosocial perspective to determine what is it that defines the elderly person who is at risk for severe disease from those who wasn't.
Many Quebec long-term care facilities, like this one in Montreal, were hit hard during the first wave of the COVID-19 pandemic. Now researchers are studying why the virus has so severely and disproportionately affected the elderly.
In the Quebec population, which has been decimated and continues to be at risk for severe COVID, how prevalent is this autoantibody problem? So we want to actually sample the elderly population in the long-term care facilities and see who is at risk and who isn't, and will that hopefully guide, intervention should there be another wave.
The study will recruit 850 participants in Montreal to compare the immune system response of those who were infected without symptoms, with severe and moderate symptoms, and those who weren't.
Very interested in knowing the conclusions and see if by pure chance or, whatever happens, if they are not going to eventually say, whoa, we have a problem here. There's too many COVID deaths in the province.
91.2% of COVID-related deaths in the province are aged 70 and up.
If scientists like the research you're talking about are good to make the kind of research that will eventually confirm or contradict or give us more information of what these people died from.
The $2.7 million study supported by Canada's COVID task force will look into COVID in seniors through immunological, cardiovascular, and psychological perspectives.
The results of our project are going to be analyzed and integrated so that we can actually see how those different systems interact to predict outcome.
Researchers say the data from this study will help better manage COVID long-term and short-term.
If the unfortunate situation arises where the variants of concern cause another wave, we want to have information available to help more rationally manage the next waves.
In Montreal, Brittany Henriques, City News.